Greetings. Chapter 9, Developmental Theories, Life Course, Latent Trait, and Trajectory deals with a very relevant area, and that is looking at how criminal behavior relates to the life course. And so here we begin to take a look at criminal careers and early onset of offending and how that may or may not persist throughout someone's life cycle. So this is really a developmental model, and you can go back and look at the historical earlier research that tried to follow families that were involved in criminal activities over longer periods of time, kind of a longitudinal study, if you will, to take a look. And so we have these basic ideas. For example, the life course view is basically that criminal behavior is dynamic or changing and is influenced by a host of factors that are based on the individual's makeup and learning and their traits and their characteristics and their social experiences, kind of a whole conglomeration of factors. Second, the latent trait view believes that there's a master trait or kind of an overriding trait present at birth or soon after, maybe inherited, maybe genetic, maybe brain damage based, and this may lead to criminal behavior throughout the life course. And then trajectories deals with the idea that there's multiple paths to criminal behavior and different types of criminals as well. And so looking at this, we can see certain events that may occur over someone's life may lead to criminal behavior or the law-abiding behavior. And so you can kind of see how latent trait, life course, and trajectory theories are all kind of interrelated, and certainly there are some overlaps there. One interesting life course concept is problem behavior syndrome, and there we have a cluster of antisocial behaviors that include, for example, family dysfunction, being a victim of child abuse, using drugs and alcohol, early onset of sexual behaviors and interactions, early pregnancy, problems in school, suicide attempts, seeking adventures, and what we call sensation seeking, and also being unemployed. So there we have what is kind of referred to as a cluster of behaviors, problem behavior syndrome. Also, under the life course perspective, the idea is that the basic notion here is that the seeds of criminal careers are planted early in life. So they're, in other words, they're looking at the early onset of deviant or violent behavior predicts later criminality. And according to this perspective, the finding really here is that the earlier one begins their criminal behavior, the longer, the earlier the onset by age, the longer it tends to persist. In looking at gender and age of onset, looking at males and females, the early onset for the males of antisocial type behaviors tend to lead to later problems related to employment and drug and alcohol abuse, as well as early aggression leading to later physical abuse and fighting. And with females, antisocial behavior in the early years tends to lead to relationship problems, depression, and higher risk of suicide and poor health. And we can begin to look at some of the other aspects, Sampson and Loeb's age-graded theory, for example, that looks at various pathways to criminal behavior, but then asks, well, how can someone go back, to non-criminal behavior, looking at important events and the like. One thing in looking at criminal life. Of course, we notice that the research indicates over and over again that marriage seems to act as a buffer against criminal behavior. So that's one thing we see. People who have successful marriages, that is, tend to desist from criminal behavior. And that might be a support system, also more investment in a spouse, maybe children as well, and greater supervision and non-deviant activities, for example. The latent trait theory, as I mentioned, focus on a particular personal characteristic or trait, and that's early on or at birth, for example. And this personal trait becomes really an important trait that leads to criminal behavior. One of the areas that's focused on is impulsive behavior, and or people that tend to lack self-control. They kind of just do things off the cuff. They seem to get angry at small things and steal things, just not thinking about it, and hit people, and so on. And then looking at a general theory of crime, we look at this impulsive behavior as kind of a major problem that may have a biological basis, but also the environment interacts with this as well. The general theory of crime focuses more on the self-control issues, and of course there is a lot of research that supports that. And as I mentioned, the trajectory theories tend to look at the idea that there's multiple paths to criminal behavior and very different types of criminals, and that some will specialize and some will be more generalists that engage in a variety of criminal activities. And we also can look with trajectory theories, recruiters versus lone wolves. The recruiters basically are those that seek to train others and kind of socialize people into a criminal lifestyle, where the lone wolves are those who tend to offend on their own. And your authors point out that most crimes seem to be committed by lone wolves rather than criminal groups, but I'm sure there'll be a lot of debate about that, especially when you bring in the factor of gangs and organized crime. And there's some really good material on evaluating these developmental theories, kind of seeing what the research says, and there's of course support for them. But there's also some issues with the theories and measurement and research processes. But one thing that we see is that a multiple-pronged approach seems to be very important, especially early intervention. And so we're talking about here adequate prenatal care to prevent many of these problems, postnatal care, early intervention among preschoolers who show signs of aggressive behavior and impulse control problems, and into the school years as well, continued support, early identification. I can't stress that enough, especially in the research that I've conducted on sex offenders. We often find a rather large proportion of sex offenders first offending in their childhood or adolescent years. And so, of course, early intervention would be extremely important to encourage desistance, encourage these individuals from stopping, or in fact preventing some of these behaviors from worsening. Of course, preventing the behaviors in the first place would be of primary importance as well. And this wraps up this video.